Hello. There's something I would like us to think about. Now, let me first say that I'm not a scientist, I'm not a mathematician, and so I can't teach anybody science or mathematics. But I'm a journalist, so I can ask questions. And I have a question. Let's start at the beginning. On the 30th of March, the president announced a lockdown. Now, at the time, we had 59 cases of COVID-19 in Ghana. Okay. Now, the lockdown lasted 21 days. And during that time, the government did something called enhanced contact tracing. So out of the 59 cases, we were able to trace 49,700 contacts, people who had come in contact with these 59, and then those who had come in contact with them, contacts of contacts, and so forth. Now, we lifted the lockdown just this week on Monday, and at the time, our caseload was 1,042. That's how many cases we had at the time we lifted the lockdown. So I think you can see where I'm going with this. How many contacts will 1,042 cases generate? Well, like I said, I'm not a scientist, I'm not an epidemiologist. So the only thing I can do is I can estimate. If I was a scientist, I would be able to bring in certain factors like the viral load of each case, how easily the virus transmits from one person to another. I'd be able to bring in all of these factors. I would even be able to tell you, if I was a member of the Ghana Health Service, perhaps how isolated were these people when they got infected. All of these would be factors, variables that would help us calculate the contacts. But we don't have them. So what we have to do is we can assume all things being equal, okay? So all things being equal, if about 50 cases gave us about 50,000 contacts, then about 1,000 cases, we can expect, all things being equal, that it will give us about 1 million contacts, okay? 50 cases times 1,000, 50,000. 1,000 cases times 1,000, that's 1 million contacts. Now, here's the thing. So far, Ghana has tested a number of cases, about 68,000 cases, okay, altogether. 68,000 tests have been done. Now, out of the 68,000 tests, we have had 1,042 positives. In fact, yesterday that was updated to 1,154 cases as at yesterday. So that is about 1.5% of the 68,000 tests. Forgive me. See, I told you I wasn't a mathematician. So out of the 68,000 tests we've done, we've had about 1,154 positives, which is about 1.5% of all the tests we've done so far. So again, all things being equal, we can assume that if there are 1 million contacts to be tested, about 1.5% of them will turn out positive, which is 15,000. So there is a possibility, all things being equal, that there are 15,000 positive cases out there yet to be discovered. Now, this is the thing I want us to bear in mind. These 1,042 cases that were discovered by the end of the lockdown, most of them, in fact, almost all of them, if you take out the 59 who were positive before the lockdown started, the rest of them, you can assume during the 21-day lockdown, that's when most of these people got infected, during lockdown. So now that the lockdown has been lifted, and there is a possibility that we have about 15,000 infected people out there, the question is, Has the lid blown off this thing, or are we still in control? Is there a way of checking to find out whether this modeling that I'm doing here, based on my very limited maths and science, whether it is accurate? Where would these cases be? Would they be among the affluent people? Would they be among the poorer people? Would they be in the slum areas, or would they be in the residential areas? Would they be in the 2 cities that were locked down, or would they be in the remaining regions that were not? These are questions that I would love to see answers to. But one thing is clear, we certainly have a lot more testing to do. Now, all these figures come from the Ghana Health Service website, and so I'm happy to get your opinions on this. If there's something wrong with my mathematics, please let me know. If you have some of the variables that I don't have that can help us get more accurate with our assumptions, please let me know. But either way, can we start thinking about this? Thank you.